How do I find out more about immunisation against diseases in Australia? We are the Immunisation Coalition, and we are here for you. We're a trusted, independent and not-for-profit organisation with a membership that consists of many of Australia's most experienced immunisation experts. Immunisation against infectious diseases protects the well-being of all Australians. Vaccines are rigorously tested before they're approved for use and are continually monitored thereafter. We provide education and the most up-to-date clinical information for healthcare professionals, including doctors, nurses, pharmacists and other immunisation specialists. We work closely with Australian health departments, agencies and advocacy groups to drive awareness of the benefits of immunisation using science-based information. Misinformation about vaccination can have a damaging effect on our communities, now and into the future. Make sure you have the most up-to-date evidence-based information when it comes to immunisation. Go to immunisationcoalition.org.au to find out more.
Public transport isn't the only place that you're at risk. I want to show you how extremely contagious the flu virus is. Look at how many people are touching the same surface. And just imagine for a moment how many people have already touched it and how many more will. You can catch the flu in a lift, at work, in the kitchen, even at the movies. Any place where a lot of people are passing through. The flu is a highly contagious disease. It's spread by people coughing and sneezing or by contaminated surfaces. When you catch the flu, you can feel awful for days, like you've been hit by a truck with a fever. You just can't get out of bed. But even more concerning is that you can pass it on to vulnerable people, to little babies, to pregnant women, to people with chronic medical conditions, and also to the elderly. Public transport is the perfect flu and cold incubator. Look at how many people are touching the same surface, and think about how many more will have touched it before and after. All it takes is to come along, touch that surface, then touch their nose or later rub their eyes, and the virus can be transmitted. When the flu virus gets into your body, it penetrates cells in your respiratory tract. Once there, the virus can replicate itself in one cell, then many, and it gets a foothold in your lungs, so that when you sneeze or cough, the virus can exit your respiratory system, a great way to spread themselves around. The flu virus mutates regularly, and that's why we have to have a new vaccine every year. But it's also why the flu on average is much more severe than the common cold. So how do we stop the flu from spreading? And how do we protect ourselves? Sneeze or cough into a tissue or into your inner elbow. Avoid shaking people's hands and wash your own hands often. And if you are sick, stay at home. Studies have shown that the flu can survive for up to 15 minutes when transferred from tissues to hands, an hour or more in the air in enclosed environments, and more than 8 hours on hard surfaces. The flu shot reduces flu-related hospitalisation in children by up to 3/4, and over half in people over the age of 50. The flu vaccine provokes antibodies against the flu virus. You cannot catch the flu virus with a flu vaccine shot because there's no live virus in the vaccine itself. Vaccination is the best defence to stop contracting the virus. And that's why I get the flu shot every year. So to fight against the nasty influenza virus, you should have regular exercise, a healthy diet, practice good respiratory etiquette, but your best bet is to have an annual influenza shot.
Can you afford the flu? The flu, or influenza, is a highly contagious respiratory illness spread easily from person to person via droplets and small particles produced when infected people cough or sneeze. The virus is also transmitted via hand contact with contaminated surfaces. The flu may lead to serious complications, including bacterial infections, hospitalization, and even death. Symptoms can include high fever, dry cough, headache, sore throat, muscle and joint pain, and feeling unwell. The flu can affect anyone, including the fit and healthy. Those at highest risk include Aussies aged 65 plus, Aboriginal and Torres Strait Islander people, pregnant women, young infants, and people living with chronic conditions. There are 3 types of flu viruses that infect humans, types A, B, and C. However, types A and B are the overwhelming majority of flu viruses that humans are exposed to. Throughout most of Australia, flu outbreaks mainly occur between late autumn and early spring and can vary from mild and sporadic to serious epidemics. The stats are revealing. Almost 68,000 Aussies contracted the flu last year. Up to 3,500 older Aussies die from flu-related complications each year. What's more, an estimated 18,000 Aussies are hospitalised with flu-related illnesses each year. The flu causes approximately 1.5 million lost workdays each year and an estimated 300,000 doctor visits annually. So how can you help reduce your risk of infection? Wash your hands frequently. Cover your face when coughing or sneezing, and throw used tissues in the bin. The Australian government recommends an annual flu shot for anyone aged 6 months or older to reduce their likelihood of contracting the flu. To help protect yourself, loved ones, and colleagues from contracting the flu this winter, get vaccinated. Talk to your doctor to learn more.
The circulating flu strains change each year, and so does the vaccine. And that's why it's important to get the flu vaccine each year. Children who get a flu vaccine are less likely to get sick and are less likely to get admitted to hospital if they do get sick. The flu vaccine also stops the spread of flu in the community, which means that we can protect those people who are either too young or too sick to get the vaccine themselves. The great news is that this year, the flu vaccine is free for children between the ages of 6 months and 5 years. So please head down to your GP or your local hospital immunisation service and get your kids the flu vaccine today.
I know a lot of people who feel that if they're looking after themselves, that they're eating well, that then they won't get influenza. And it's important to look after yourself as much as possible and have a healthy diet. But influenza is going to attack people whether they're healthy or unhealthy, whether they have chronic disease or not. We hope that if you are healthy and living right and you get influenza, that it's not as severe a disease as it could be if you're not looking after yourself. But living well won't prevent you getting infected, and it won't prevent you passing it on to other people in your family, maybe your grandparents, mainly vulnerable people you come in contact with. And so even if you believe that you're not going to get the flu, or you won't be impacted by it, you can be unlucky and have severe disease even though you're healthy, and you can pass it on and give severe disease to somebody else. So even if you're healthy, it's important to have an influenza vaccine every year.
Well, the flu vaccine is very effective at protecting you from influenza. That's an annual infection, especially of the respiratory tract, the nose, the throat and the lungs. And it's an infection that's easily preventable by a safe and effective vaccine. The influenza virus is amazing. It's an RNA virus like coronavirus, so it can mutate quite quickly. Even in the course of a week or two, it can change. And sometimes it mutates so fast, it mutates actually in your body while you're sick, and it's multiplying in your body. On average, 3,000 Australians die every year from flu, so it's a disease worth preventing. Because your immunity varies from year to year, it actually wanes, it drops off, and because the virus itself changes, because it mutates, we give a new vaccine every year. Generally, we get between 50 and 70% protection against influenza from influenza vaccination. The vaccine actually covers 4 strains, and each of those can vary year on year, and so each can be altered and updated every year. What's happened in the last 2 years is that because of all the restrictions on travel and social behaviour, we haven't had flu seasons for 2 years. And people forgot to get vaccinated last year in 2021, including me. I had my COVID vaccines and forgot to get my flu jab. So there's a lot of people who haven't had a jab in 2021 who should be getting one, and a lot of people who will benefit from the jab because the level of immunity out there is much lower because they've not been exposed since 2019 to a flu virus. The borders have opened up already. People are coming into Australia from the Northern Hemisphere where they've caught flu, and they're bringing flu back to Australia as we speak. So we will see at least, I believe, a moderate season this year in 2022 because there's a lack of immunity in the community and because flu is being brought back in on planes left, right and centre. A large proportion of the population are actually indicated for free to have a flu vaccine. That includes children under 5, Indigenous Australians, pregnant women, people aged 65 and over, and people with a chronic medical problem. All of them can go to a GP or a pharmacist and get a free jab. People in between who want to make sure they don't lose more time from work can get vaccinated at a fairly low cost from a pharmacy or a GP, and it's worthwhile having whether you're a well or an unwell person.
The flu virus spreads very easily, so here are some tips to help you to stop spreading the flu virus. Firstly, regularly wash your hands thoroughly and don't share cups or cutlery. If you need to sneeze, cough or sneeze into your elbow, and remember to use tissues instead of hankies. Throw away the tissues straight away and wash your hands. And most importantly, if your child is sick, please keep them home from daycare or school so that they don't spread the virus to other children. The best way to protect your kids from the flu is to give them a flu vaccine. Last year, only about 5% of healthy kids got the flu vaccine, and yet half of those children admitted to hospital last year were completely healthy before they caught the flu. We need to do much better this year. We do understand that it can be hard to get your kids vaccinated, that you may need to take time off work to visit your GP, and it can be a juggle, especially if you have lots of children. But just remember that flu can be a very serious illness, and it's important to take the time out at this time of year to get your kids vaccinated.